is Belinda Roscoe. Today's date is October 7, 2018, and I will be demonstrating where the appendicular skeleton points are at. First, I'm going to do the anterior part of the skull. If you zoom in a little bit, you can see we have the frontal, zygomoid, mandible, maxilla, and then you have your sphenoid, and you have the nasal right here, vomer. Next would be the ethmoid, and inside the eye, it is the lacrimal, which is right in there. Next portion would be the posterior skull. You have your occipital, parietal, temporal. Well, you can't really see the temporal, but you can see the mandible jaw right here. Next is the lateral portion of the skull. You have your zygomoid right here, mandible, your maxilla, temporal, occipital, your frontal, and your parietal. You can clearly see those. Sphenoid right here, ethmoid, and the nasal cavity itself. I think that's it. Next is the thorax cage, where you have your clavicle, your body sternum right here, and then the first 7 ribs are your true ribs. After that, the 8 through 12, these are your false ribs, and these 2 ribs right here, those are the floating ones. Up here will be your manubrium, and your scapula, if you can see right here, right there. So next will be the vertebrae part of the so for back here on the cervical part of the spine, the very first one, that's your atlas, and the second one, your C2, is your axis. But the first all 7 ribs are part of the cervical part of the cervical. Next follows the thorax, follows with your lumbar, your sacrum, and your coccyx right down here. Next to the pelvic region of the skeleton, you have your ilium, your pelvic bone, ischium, your femur, patellar, patellar. Next would be the radius, and I'm sorry, not the radius, the fibular, and the tibula. This is the tibia, this is the fibular. Yeah, I mentioned the clavicle, your humerus, and then you have your ulna, which is right here on your pinky side, and your radius right there. Now you actually have to zoom in for the hand part right here. So we have your capitate right there. So the capitate right there, hamate would be right next to it. Next would be your trapezoid, trapezium, scaphoid, lunate down at the bottom, and right here at the bony part, that would be your pisiform and your trapezium, and the little joints right there, that's your sesamoid. And lastly is your foot. I have your calcaneus, cupid right here, talus, navicular, your metatarsal, phalanges, and then you get into your lateral, cubar, the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. And that's it. Thank you.